Hey guys, welcome back to another video. So guys, somebody asked that I should tell that person signs and symptoms of bipolar. My dear, signs and symptoms of bipolar are so many, and just giving you, maybe if I just decided that I want to highlight, maybe you will not get what I'm trying to talk about. So, and it was in the comment on my DM. So imagine just giving you a list of signs of bipolar, and you don't know what bipolar is, how does it look like, who does it affect. Yeah, so I want to talk about something small about bipolar, because bipolar is one of the mental illness that most people usually suffer from from this condition. So let me get into the video. Bipolar disorder previously was known as manic depressive illness. It is a mental condition characterized by significant mood swing that include emotional high, which is mania, or hypomania, and low emotion, which is depression. So this mood shift can affect the sleep, energy level, behavior, judgment, and the ability to think. So you find that people who have bipolar disorder have the condition interfered with their ability for judgment, the behavior, how they think. They're not thinking like a normal person. So remember, we have also types of the bipolar, and these are the types of bipolar. Bipolar 1 disorder, bipolar 2 disorder. We have also another one that is known as cyclothymia disorder, and also other specific and unspecified bipolar related disorder. So those are 4 types of this bipolar disorder. So I'll explain. So bipolar 1 disorder, defined by manic episode that last at least 7 days, or manic symptoms that are so severe that needed immediate hospital care. And also depressive episode occur as well, as lasting as 2 weeks. So you find this person has a manic episode and depressive episode. So manic episode will last at least 7 days, and depressive episode will last for at least a period of 2 weeks. That is a person who is suffering from bipolar 1. Bipolar 2, defined by a pattern of depressive episode and hypomanic episode, but cannot be full-blown manic episode. So this person sometimes cannot have a full-blown manic episode, the person who is having bipolar 2 disorder. If you don't get it, you will let me know so that I clarify better. So cyclothymia, a milder form involving numerous periods of hypomanic symptoms as well as period of depressive symptoms, and lasting for a period of years, or of 2 years, 1 or 2 years. And also we say that we have others which are specified and unspecified related bipolar disorder, and these include bipolar disorder symptoms that do not match the 3 categories. They do not match the bipolar 1, the bipolar 2, the bipolar cyclothymia disorder. So what are the signs and symptoms? The person who asked about the signs and symptoms of bipolar disorder, remember, if maybe I could just pronounce, or I could have stated about the grandiosity. Do you know even what grandiosity is? You don't know. And do you know it is the symptoms? We have the hypomanic symptoms and depressive symptoms. Yeah. So under hypomanic symptoms or manic symptoms, you have increased energy, activities, and also restlessness. Sometimes you are energetic, and sometimes you are so restlessness. Also, you can have excessive happiness, over a joyful or extreme irritable mood. Something small is irritating you. You can have decreased need for sleep. You can have impulsive or risk behavior, poor appetite. Yeah. So let's go to depressive episode, feeling of sadness, apathy. This is where you can have suicidal thoughts. You can have a loss of interest on pleasure in most activities. You can have insomnia or sleeping a lot, fatigue, loss of weight because you are not eating, difficulty in concentration, thoughts of death, yeah, suicidal thoughts. Those among others. You can also list them for me so that we learn. So those are some of the symptoms of bipolar disorder in general. Treatment of bipolar, it involves medication, the mood stabilizer, antipsychotic medication, and antidepressant medication. And psychotherapy also is very important when you are dealing with someone who is bipolar, and also lifestyle changes. You know, sometimes these bipolars can be triggered by maybe use of drugs. Yeah. So those are the things that you can change. You can have a balanced diet, sleep well, among others. Another thing that I'm about to forget is the causes of bipolar. So the exact cause of bipolar disorder is not fully understood, but severe factors are believed to continue to contributing to development or starting all the etiology of bipolar. So we have some genetic factors. These are evidence that bipolar disorder run in family and indicate an a genetic component, individual with a family history of bipolar disorder or any other mood disorder are at a higher risk of getting bipolar disorder or any mental illness. Also, biological difference. Studies have shown that individuals with bipolar disorder may have physical change in their brain, especially a neurotransmitter imbalance are also thought to play a role of in mood regulation. So it can also be a cause or a trigger of bipolar. Environmental factors, stressful event, trauma, or significant changes in a person's life can contribute to bipolar disorder. Also, another thing that can also contribute are substance abuse. Those who use these strong drugs, like bang, cocaine, those things can interfere with your brain or mood changes. Even alcohol can interfere with the how your brain works, and you can have bipolar or you can have changes in the mood, yeah, and with the time you can suffer from bipolar, especially if this condition or this mental illness run from the family. Avoid any trigger that might cause the disease. Hormonal changes, which it has been said that hormonal fluctuation can occur during puberty, pregnancy, menopause, and these may contribute to onset of bipolar disorder or exhibits the symptoms. So those are some of the things that are assumed that they can contribute or can put you at risk of getting bipolar disorder. Yeah, so I think I'm gonna stop from there. Let's meet in the next video. Tell me which condition of mental illness you want me to talk about. But we are if you are following my videos, in the next video we are going to talk about another mental condition, another condition of mental illness. What am I saying? Another mental illness condition, whichever. We will talk about another condition which is mental disorder. So stay tuned. Make sure you watch this video up to the end, share the content, like the video, comment. Don't forget to turn your notification bell so that every time I post a video, you'll be the first person to be notified. Bye, till next time.